The new COVID-19 variant reaches the United States, and a state is ramping up efforts to track it here in Texas.
We just look for genetic fingerprints and compare them over time to see how it's spreading and how it's changing over time.
We go in depth with the state's top epidemiologist what Omicron means for vaccines and treatment in Texas. Weeks from winter, Texas regulators add rules to make sure natural gas suppliers are prepared. But critics say it's not enough to prevent blackouts like the ones we saw in February. We look closer at the plan and concerns over what still needs to be done. Tickets and fines for drivers who didn't do anything wrong. We found out some Texas license plates are not being read properly, why it's happening, and how the state's taking action after our investigation.
Produced from the Capitol in Austin and airing statewide, this is the award-winning State of Texas.
Hello, and thank you for joining us. I'm Josh Hinkle. The Omicron variant of COVID-19 has been detected in the United States, and Texas is taking steps to prepare. Previously, the Department of State Health Services depended on the CDC for virus sequencing to track which variants are already in Texas. But now, the state is beginning to conduct its own sequencing. Maggie Glenn got an inside look at the state's lab and how it will help our response to the new variants.
While the state awaits more information on the latest Omicron variant,
We think that it could already be here,
DSHS is increasing its sequencing efforts.
and it's just a matter of detecting where it is.
In a partnership with the University of Texas's School of Public Health, the state will be able to increase its sequencing by 25%.
COVID samples get sent to the virology team for extraction, and then the RNA gets delivered to us, and we start the sequencing.
The process starts with samples from PCR tests and makes its way through a 3-day analysis.
What we do is look at each part of that genetic sequence, and we can look for changes. So we know the original one that came out in China, and we know then the changes that have happened since then.
The new partnership also gives Texas more control over where the state will pull the samples from.
So CDC has done a fantastic job of really trying to sample all across the United States and getting a good number from Texas. When they use their contract labs, though, we don't have the chance for input on really where that sampling across the state is happening.
That's important given the state's size. Central Texas, Region O, for example, has a relatively low COVID hospitalization rate sitting just below 3%. But in the Panhandle right now, Region A, they're reporting an 18% COVID hospitalization rate.
We have a lot of small towns in our community that refer patients to hospitals in Amarillo. And with that, then we just aren't able to accept all those patients that need to be transferred.
And we want to make sure that we will be able to recognize when a variant pops up in El Paso, even if it's not over in Tyler.
Maggie Glenn for State of Texas.
The state's chief epidemiologist also told us doctors may need to switch strategies on treating patients with COVID-19. That's after Regeneron announced its monoclonal antibody treatment could be less effective against the Omicron variant. Infusion centers have been set up statewide to help sick patients access the doctor-prescribed drug treatment. Regeneron sent a release last week revealing that early research shows a decline in the drug's effectiveness against Omicron infections. More testing still needs to happen. However, since almost all cases currently affecting Texas are the Delta variant, the monoclonal antibody treatment is still great at keeping people with COVID-19 out of the hospital. As news about the new variant spreads, some Texans are wondering whether it's worth getting the vaccine. The rationale goes something like this: why get the shot if it might not stop the new variant? Maggie asked that question to the state's top epidemiologist.
What's your response to those people who, again, still haven't been vaccinated and hear Omicron as a reason not to get vaccinated?
So we still have a lot to learn about Omicron, including how well vaccine-based immunity is going to work against Omicron. What we do know from previous variants, though, is that our vaccines have been effective. And that even if they aren't 100% effective at preventing infection, that they maintain protection against severe illness, hospitalization, and death. And so we have a reason to believe, based on previous experience, that vaccines will still be beneficial even with the introduction of variants. And so it's still very important for people to go get vaccinated if they're eligible. COVID is still present in our state, and we are still having a lot of COVID-19 happening here in our state and around the United States. Omicron coming will only add to the burden of disease that we're having in our state, we're already at a point in our hospitals where some of our hospitals are feeling stressed. When flu activity also increases, that could be a real crisis for our healthcare system. So it's really important not only that people go out and get their COVID-19 vaccines, but that they also go get their flu vaccine if they haven't yet. Again, flu on its own can be a life-threatening illness, and it can really stretch our healthcare system. But flu with COVID, it could be even more life-threatening than either one of them on their own. So really want to emphasize the importance of everyone who's eligible going and getting their flu vaccine this year.
As concern over the Omicron variant grows, the Texas Panhandle is seeing a new spike in cases of the older Delta variant. Their health authority says the area's low vaccination rate is a big factor.
I think part of it is the that independent West Texas spirit of people don't want other people to tell them what to do. And sometimes that translates into a little bit of a recalcitrant response to guidance, whether it be from the state or the feds. And that ends up making people less likely to get vaccinated, to wear a mask, to do those things that we know are helpful in preventing disease transmission and preventing hospitalizations.
Just 44% of those eligible for the shot in Amarillo are fully vaccinated. For comparison, the state's average is close to 60%. A state agency takes action to prevent problems that led to devastating power outages during the February freeze. The new steps that could help keep the lights on this winter. American allies left behind in Afghanistan. As refugees resettle in Texas, one congressman tries to get attention for those still at risk.
We not only left them behind, we betrayed them after we promised them that we would protect them.
The effort to help allies still trapped in Afghanistan and the push to get answers about what went wrong. First, though, a man says he paid to park his car, but still got a ticket because of his license plate.
I worry about my vehicle being towed, having to spend $300, $400 to get it back when I've done everything I can to comply with the rules.
Our investigation reveals a problem that could be affecting other drivers in Texas.